Welcome in, hello everyone. Welcome in, welcome in. Thank you for joining. Let's see. We're going to go ahead and get started. Hello, Mad Mike. Welcome in. I'm going to share the live. Variability. All right, just give me a moment. Good to see everyone. Oh, my phone just went dead. What the fuck? Hello, just give me a moment as we are dealing with a little bit of technical difficulties, but bear with me. YouTube, you're looking good. IG, you're looking good. Facebook, you're looking good. TikTok is being a little interesting. All right, just give me a moment as I get things back. Yeah, that was wild. It just kind of went off. All right. Bear with me. Come on. Okay, there we go. Variability. All right, let me edit my goal. Bear with me, everyone. All right, there we go. Hopefully now it will do its thing. Hello. Let's see if we can get it going now. Let's see if it will stay on. What will happen? Let us see. Hopefully it will do it now. Ah, no. My phone just kept going out. Yikes. All right, so I'll go ahead and get started here on YouTube. I don't know what's going on with my TikTok. It just keeps going out. Bear with me. Let's see how this goes. Yeah. Okay. Yeah, I don't quite know what happened there. Delete that video. All right, so I will go on live later today. All right, so I'm going to go ahead and get started and teach this class, and then I'll go on live later today. Okay. So if you are in our Intro to Holistic Medicine class, this is just a lunch and learn. This is not a part of the Intro to Holistic Medicine, but if you're interested, you can click the link in my bio and fill out the form and then register there. So we're looking at heart rate variability today. So heart rate variability looks at quite a bit. All right. So heart rate variability is what our topic is for today, just so that we have some context to what we are discussing. Heart rate variability is used in conventional practice. It's just not used, I believe, effectively within practice. I don't know why this keeps doing this. Yeah, my phone is fried. All right, hopefully it will do its thing. Okay. All right, here we go. Apologize for some of the technical issues for today. I'll have to trim this out of the original video. Okay, so we're going to discuss heart rate variability today. And so heart rate variability we use to really measure the autonomic nervous system. It helps us to look at stress, the overall impact of stress, and how stress impacts us, and specifically our autonomic nervous system. Again, I don't know, this thing has a mind of its own. It's doing its thing. Hold on, let me try to get it to stop. Okay. I am just going through it today. I'm having several technical problems today. Okay, let me see if this will stop. Okay, so heart rate variability measures the time variation between the consecutive heartbeats. And so let me see, this is, really not working well. Hold on 1 second. Let me get to where we need to go. All right, so I'll go ahead and just restart really quick just because it's been a little funky. So welcome into our class today on heart rate variability. My name is Dr. Erica Steele. I'm a board-certified naturopathic doctor. I hold 7 degrees in my field. They're all in the natural healthcare space. Today we're going to talk about heart rate variability. If you want access to this replay, it will be available in one of our community groups. If you are not a member of one of our community groups, I do encourage you to join one of them. We have several different groups available, including our holistic health cohort for those people that are interested in training under me in holistic health coaching. We also have a holistic lifestyle community. This community is geared towards if you want to heal yourself as well as your family. And then our Pure Black community, which is more for Afro-Indigenous people or Black people looking to heal from intergenerational traumas. We also have several different courses we're about to launch, but right now we are in week 7 of our Intro to Holistic Medicine course. It is a self-guided course, even though I do teach it live. You can watch each individual video as a standalone video, and naturally you want to watch them in progression because it builds upon each other. These classes are available within the course shell under the Learnings tab, so you'll just go ahead and click under the Learnings tab and look through, and then you'll find Intro to Holistic Medicine there. It looks a little different than it looks there because I've changed it up. I am a holistic doctor, so we look at the root cause of the person, why a person is unwell, and we look at the lab data, right? So we look at either functional, genetic, biochemistry, or in this case, we're going to be looking at heart rate. And as we look at heart rate, then we can apply lifestyle and mind-body techniques, or even nutraceuticals or herbal supplements to help support the heart rate. And then we also use biofeedback. So conventional medicine often overlooks stress as a meaningful response to just the external and internal world, and don't really have any specific solutions related to stress other than pharmacological. So we look at stress as an internal as well as an external experience, and then from there we build and grow. And so as we are exploring heart rate, we want to look at it from a perspective of this is one piece of the puzzle and not the entire puzzle, but merely one piece that we look at in holistic medicine. Conventional medicine is a little bit more linear in the sense that it just isolates out illnesses or isolates out an event, and patients are very passive in their care, meaning that they're not really going to be focused on what it takes to heal, and definitely not hold their patients accountable to actual healing practices. So we want to be more proactive instead of reactive, and in holistic medicine, we're often more proactive instead of reactive with our healing. And we teach our patients what they need to do specifically in order to heal. So a lot of times, I hear a lot, oh, well, doctors don't, recommend nutrition, or doctors don't recommend meditation, or doctors don't. Well, conventional doctors don't do that, but holistic doctors do, because we look at the whole person and how your mental, emotional, psychosocial, and even your environment impacts. So today we're going to understand stress and how it impacts the body. We're going to learn how to track our recovery, and then naturally we're going to learn how to optimize our health. And so this particular class will teach you how to measure your heart rate and also look at your nervous system. We'll look at basic tracking devices and how to improve for stress reduction, digestion, metabolism, longevity, and various other health concerns. So you're going to have a step-by-step guide of how to track your heart rate for stress management, practical strategies to optimize the nervous system function for better health, and then naturally how to use your heart rate tracking to improve your sleep, digestion, and your metabolic balance. If you are interested in more of a data-driven approach to your health, where you track your body's responses and you understand and learn how to biohack and optimize the body to improve your overall health, you are in the right place. And today we're going to again talk about what is heart rate, why does it matter, how it affects the autonomic nervous system, and the science behind it. So let's go ahead and jump in. Heart rate variability actually measures the time variation between consecutive heartbeats. So when your heart finishes beating to the next beat. And unlike basic heart rate variability actually looks at your autonomic nervous system function. So it looks at your nerves and how your nerves are sending that signal. And so the higher the variability, the better your stress resilience and recovering. The lower it really talks about how you're internalizing stress and how that can impact your body long term. So we look at the body's stress response, and we're going to help identify triggers before symptoms actually occur within the system. First things first, let's go ahead and look at the nervous system. So we have several different parts of the nervous system. First, your central nervous system, which is your brain and your spinal cord, which processes information and coordinates responses. Then we have your autonomic nervous system, which controls your involuntary functions, such as your heart rate, digestion, breathing, etc. Now, there's two different branches. We have your parasympathetic and your sympathetic. So your parasympathetic is going to be more of your rest and digest. It's going to help increase your heart rate, and your sympathetic, which is your fight or flight response, is actually going to accelerate your heart rate and decrease your heart rate. So when we measure our heart rate, we're looking at the balances and indicating your stress level and recovery capacity across these different branches. When we're looking at heart rate affects various different things, such as chronic stress, which can then impact digestion and metabolic health, which we've been discussing all this month as we've been exploring, all this week. Last week, we really talked about stress, and the impact of stress. So this is a continuation of that talk about stress, and this just is more specific to the heart rate because you'll be tracking your heart rate in that class. So typically how the heart rate reflects stress response, so you have a stress trigger, and then what happens is that sympathetic activation increases the heart rate and decreases your recovery or your variability. And so we want to measure your change. So the heart rate is going to drop immediately, providing that early warning. So it lets us know when the heart rate drops, it lets us know that the body is under stress, the autonomic nervous system is under stress, and we know naturally the recovery time is going to be skewed. So the recovery phase is when the heart rate increases and goes back to adaptation. So it drops under stress, and then as it begins to adapt, it goes up. And so we want to learn how to build resilience between the ups and the downs of our heart rate, and learn how to balance our heart rate and have more biofeedback or more control over our heart rate in general. Heart rate does impact the mental health. Naturally, the lower the heart rate is a stronger correlation between anxiety disorders, depression, because remember that internalized stress response, right? And then emotional regulation, the higher the heart rate, the better you're able to adapt to the various changes that happen, both with our mental as well as our emotional health. Heart rate biofeedback training helps with that stress resilience. So as you begin to learn how to manage your autonomic nervous system's responses to stress, you're also able to now regulate more of your emotional responses in kind. Naturally, your sleep is going to improve as you begin to monitor your heart rate and begin to develop your stress resilience. Speaking of sleep, your heart rate fluctuates throughout your various sleep cycles. Higher value naturally is deeper sleep, deeper recovery. And then when you are in that greater sleep, it's going to help that parasympathetic activation, rest and digest, which of course is going to help with cellular repair. So if you are not sleeping well and you have, let's say, a chronic disease, or you have another condition that you're trying to heal yourself from, not having good sleep is definitely going to inhibit your body's ability to heal long term. There's a lot of disruptions with your sleep, and sudden drops can reveal things like sleep apnea, stress reactions, or even environmental disturbances. So a lot of the wearable devices will actually track your sleep, track your heart rate while you're sleeping, and then give you that data so you can kind of get a sense of how your system is functioning while you're sleeping. And then as we track that information over time, we're able to really see your averages and really see how you're adapting not only to stress, but how your sleep is assisting you in your healing process or impeding you. Their circadian rhythm is that 24-hour cycle that allows for your nervous system and your hormonal system to come more into balance. So we talk about the circadian rhythm and how the body balances itself over that 24-hour sleep cycle. When your system is under immune system attack, your heart rate again is going to decrease because again it's a stress during that acute immune response, and so there's inflammatory activity that's happening, and then as it's persistently low, now you're having more systemic inflammation and more compromised immunity. So if you have a deeply low heart rate, just know that your inflammatory process in your system is going to have a more weakened immune system. We want to really work on improving our heart rate resiliency, and just that alone is going to allow for greater recovery time and greater cellular healing, and so naturally our immune system is going to improve. And so we really want to be mindful of, our heart rate and averages, being mindful of any sudden drops and or a lack of consistency below what the numbers need to be. So as you age, your heart rate is going to typically decrease by about 3 to 5% per decade. And we know that the higher the heart rate variability, the higher your health, between your cardiovascular health and your longevity. And so now that's where we start to determine where our chronological age is versus our biological age. So meaning the amount of years you've been on the planet and maybe not necessarily indicative of how your system is functioning biologically. So if you tend to ride more into that higher heart rate variability, biologically you're going to, even no matter chronologically what age you are, biologically you're going to be kind of more healthier, agile, definitely tapping into that longevity. Also, as you maintain a strong heart rate, what tends to happen is cellular resilience, so the body begins to bounce back more quickly. And regular exercise as well as meditation helps to intervene and help again improve these heart rate numbers. When you have chronic conditions like cardiovascular disease, that reduced heart rate actually is an indicator of future cardiac events as well as mortality risks. So we do want to measure the heart rate, especially if you have had a previous cardiovascular disease or if you're trying to prevent one. If you have diabetes, heart rate declines, then precedes a diabetic neuropathy by several years. So again, when we're looking at these chronic diseases, not tracking heart rate really shows us our stress load and our ability to heal. When we improve these trends, it really helps to allow the system to be able to heal in a much more effective and efficient way. In autoimmune conditions, we often see correlations of fluctuation patterns, specifically around flare-ups and remission cycles. So as we use our heart rate variability, we're going to use it as a biofeedback tool. Bio meaning body, feedback meaning receiving feedback. So it's going to first display our heart rate patterns, and then we can use conscious awareness to help shift where those numbers are. So if they're super, super low, we can work on increasing them and getting them to a higher rate. Naturally, if they're high, we like to keep them high, but let's say if you want to train it low, you can. Sometimes there are use cases for training it a little bit lower, even if you enjoy it being higher. There is also gradual adaptation to develop from that sympathetic to parasympathetic. So if you're more in that fight or flight response pretty consistently, naturally your heart rate is going to be much lower, and you're not necessarily going to have as fast of a recovery time. So we want to shift from that fight or flight mode into that rest and digest mode, and heart rate variability is most certainly a way to do that, so that you are able to build resilience over time. The faster you can bounce back, meaning the faster you can lift that heart rate up from a lower number into a higher number, the more resilience that you have, not only with your immune system, your nervous system, your hormonal system, but really all systems pretty much. In healthcare, we use heart rate. We want to use it as an objective analysis for stress-related conditions. So we try to use the number to be able to quantify your autonomic function, so your ANS system, and we want to see how it's actually functioning. And so we test the heart rate to be able to see that. So once we have trends, right, which trends typically happen over time, we track over a consistent period of time. So we recommend wearing a wearable like an Apple Watch or a Fitbit, something like that. And then that way we're able to get these averages and see the values throughout. And so as we see the values, let's say they're trending on the lower end, we know that we need to train the patient or teach the patient how to elevate their heart rate using exercise, low, moderate, or high intensity to naturally elevate that heart rate and keep it consistent. Naturally, too, if your heart rate is too high, if it's triggering, let's say, overload, overwhelm, etc., then we may want to train it down, but we don't want to train it down too much because it is more protective when the heart rate is a little bit higher. And so there are several different research studies about heart rate measurement, standardization of stress management, as providing a quantitative data for many of the health interventions. So heart rate, typically we want to look at it early as a means to detect how the health of the autonomic nervous system and the body's ability to recover under stress. So whether a person is suffering with an illness, a chronic disease, or they just want to prevent and begin to go into longevity, then we definitely want to look at this to be able to properly gauge how their autonomic nervous system is functioning. These metrics provide objective analysis, particularly for, let's say, therapy or even medicinal purposes, and it provides more of a personalized tracking methodology where you, as the patient, understand what numbers need to be, you understand what your ratios are, and then ultimately either train up or train down those numbers depending on what you want. And so heart rate variability monitoring really can be a excellent tool in managing chronic disease because, again, if you're not getting into that rest and digest mode, very difficult to heal, so delayed healing will occur. So we want to really think about our heart rate from several different vantage points. First, we want to look at our sleep quality and making sure that we're able to rest and rejuvenate. So what does that mean? That means we are laying down, we are falling asleep gracefully, we're staying asleep the entire time and sustaining that, and then naturally we're waking up refreshed. And so our sleep quality naturally is a direct impact from our circadian rhythm, which is a direct impact from our sleep. So if your circadian rhythm is off, we know more than likely your heart rate is going to be off. We know more than likely your sleep is going to be off. So as we're training this, we want to look at the natural environment, looking at things like breath work, meditation, nutrition, etc. There are a lot of simple ways to enhance heart rate variability naturally, and that's going to be, again, breath work, meditation. Usually those lower it. Hydration sometimes can go up or down. Nutrition, naturally we want things that are going to help our nervous system, not hinder them. And then movement, of course, will allow for the heart rate moving up and down. And in fact, we train on it, especially in like high interval training. We're going to kind of push that heart rate to match that recovery time. So we push it up, and then as quickly as it's allowed to fall, that shows us how our recovery time is. And so our sleep quality is going to impact our stress resilience throughout the day. So we're not necessarily going to be as stress resilient when we have a high heart rate and we're significantly stressed. So keep those in mind as you're looking at it. So some of the best tracking devices I found, smartwatches, so with the Oura Ring. Again, the Oura Ring has a subscription to it. That's why I don't really like it as much. You have an Apple Watch, which they have tons of content in the Apple Health. Very impressive, great resource. And you can always sync the data from Apple Health into any other system. And so we want to look at how our lifestyle is impacting our numbers, specifically our heart rate numbers. And we can do that really easily with a smartwatch. I tend to recommend a watch or a ring for that continuous monitoring rather than the second option, which is more of a chest strap. That's going to be more, it is more accurate, but it's specifically more for athletes, people that are training, let's say you're running, jogging, cycling, that kind of thing. There are quite a bit of heart rate training apps, such as the HRV's training and Elite training, to transform your phone into not only a measurement tool, but also something that helps analyze those trends so you can start to become more resilient to stress and more proactive instead of reactive. So we want to measure the heart rate first thing in the morning, creating a checklist of trends, not just daily fluctuations. So try not to focus on the daily numbers, really focus on the overall average, and that will help. So again, depending on what you're looking for, I do like the smartwatches and the apps, and those tend to make it easier for me to navigate. Okay, so average heart rate for healthy individuals between 50 and 100. I know that's a really crazy range. I like it about a 70. That's like a sweet spot. So we want to make sure we're not too low, we're not too high, etc. 70. Now we'll talk about training it up and training it down, but just so you know, there's a 24-72-hour recovery cycle that's attached to those numbers, and also too, there's up to a 30% improvement opportunity. And so that's a direct correlation to heart rate variability. Again, as you are beginning to master your heart rate, beginning to utilize your heart rate as a healing tool and begin to train up and train down as you see fit, that's really going to help. And so high frequency helps with the parasympathetic system. The nervous system is very gentle and subtle, and it requires very little to see the impact. So again, let's talk about how to raise and lower. So let's say if you have, let's say, a 50 or a 60, so you're definitely going to want to, improve your exercise regimen, perhaps getting out of the box of what healthcare, exercise you're doing now, and perhaps look at some other options. High intensity interval training spikes your your heart rate really quickly, and so you want to make sure that your body has the capacity to heal from it, because it'll spike it really quickly, but if you can't sustain it, then you're going to crash down. And that's where caffeine comes in, because people are trying to overcompensate for a lack of balance. I just learned, not just learned, but when I was reading Don Miguel Ruiz's book about mastery of self, he really talks about not looking at these things, especially things like exercise, from this space of wrong and bad, but more so just where you are in the present moment and then building from there. So how we lower, so raising the heart rate, naturally you're going to get your blood flow going, you're going to get your blood flow pumping, so anything that's going to elevate it like that and sustain. So that's why, repeated exercise is so helpful, because it does tone your nervous system and tones your heart. To lower your heart rate, we recommend box breathing in a 4-4 pattern. So you're going to inhale for 4, hold for 4, exhale for 4, hold for 4. And exhale again. So inhale, exhale, right? And so you're going into a box in a circle, inhale, exhale, into a box to activate that parasympathetic response. Also to cold immersions, cold water on the face, a cold pack on the chest also will rapidly reduce the heart rate and get you into more of a healing state. Again, we may not necessarily need to lower the heart rate, especially if it's consistently high. That lets us know that there's a higher recovery. But let's say you worked out really, really hard, and maybe you've triggered some anxiety or something like that. That's when you would lower your heart rate utilizing some of those techniques of cold. I remember when I was healing myself from CPTSD, while I was training with exercise, I really could not do a lot of high intensity interval training, just because it would trigger a lot of anxiety, it would trigger a lot of fear response. And so I would have to consistently keep my heart rate below a 140 while I was exercising. So I would often use cold in order to facilitate that, because we want more sustained regulation. We want more of a consistent number. We don't want to be going up and down and up and down and up and down crazily. We really want more of that consistent, sustained number. And our number we're looking for, that sweet spot, is a 70. So you may start off at a 50, and then we may have to elevate it. or even still, you may be even higher than that. Again, I'd like to be at around 70. You can be anywhere from 50 to 100. Naturally, the higher the number, the more, in theory, the more resilience that you have with recovery to your system. However, at the same time, sometimes it's contraindicated to be riding a high heart rate when your nervous system just simply is overloaded or has been overloaded. So meditation helps to lower the heart rate. This is what we use as a biofeedback tool to really learn how to manipulate the heart rate. So we meditate doing, we can use some vagal nerve tone improvement. So like humming or chanting, those all help. And then naturally that's going to allow for the system to stabilize and that stress resilience to pick up. I typically recommend a daily practice of 10 to 15 minutes of meditation to begin to build that accumulated benefit of heart rate resilience. And it takes about 2 to 3 weeks of consistent 10 to 15 minute daily practice to begin to see the effects and the impacts of your heart rate. So we're looking for, a 20 to 35% increase in your heart rate based off of the daily meditation. So let's say if you start off at a 50 and you're doing your consistent heart rate practice where you are working on your meditation, you're working on building that resilience, and then over time you can see that elevate back up to the 70 where it needs to be, because of the meditation, you're now building more of that stress resilience. So that's pretty much it with this heart rate class. It's a really short class. It's not super long because it's really just focused on your heart rate and what you use it for. I'll kind of summarize here. Where we go. This replay will be available in the community so that you're able to have access to it. It's not a part of our Intro to Holistic Medicine coursework. It is part of a stress coursework. And so it'll be a part of the Wellness Collective for a Resilient Mindset. Again, I'm a holistic doctor. If you are new to my channel, new to my space, I have been in practice for a long time. I've been in natural health care for over 20 years, and I had a general family practice in Virginia for about 10 to 15 of those years, and then closed it in 2023 to build a sustainable holistic healthcare model outside of our current conventional system, just simply because with conventional medicine, it's very symptom-driven, pharmaceutical, surgery-driven. They treat illness as this isolated event, and it's highly reactive, where the patient is really a passive participant in their care. And while they do use tests and scans and they use heart rate, they just don't really use it effectively, in my opinion. So in holistic medicine, we look at all aspects. So if a person has a chronic disease or a mental health issue, we're going to check that heart rate to be able to see what their autonomic nervous system is able to do, if it's able to recover and recover quickly. Again, if you're not able to get into that rest and digest, it's going to impede your body's ability to heal. So we definitely want to make sure that we're doing that. All right, hold on 1 second for me. Remember, heart rate measures their heart rate, your heartbeats in between, right? And again, your central nervous system is comprised of your brain and your spinal cord, which processes information and then sends that information to your ANS, which controls all your involuntary functions, such as your heart rate. So your hypothalamus is involved with it, your limbic system is involved with it, your amygdala is involved with it. So very much your heart rate is going to be affected if you've been through trauma. So I began to kind of look at this because my blood pressure was consistently low, like in the teens. And of course, if it's not, over 120, over, 80, they don't say anything. But I began to get curious about why my heart rate was so low and why my blood pressure was so low. And being a survivor of CPTSD, my system had kind of regulated itself to take on that loaded stress. And so if my body is in that loaded stress, I'm going to be more in that sympathetic response, which is more of that fight or flight, and less in that parasympathetic, which is in the rest and digest. So training my heart rate, training my blood pressure, getting those numbers up directly affects my ability to heal, my immune system, my nervous system, my digestive system, pretty much all systems are affected. And so we know that chronic stress can impact digestion. We know it can impact your immune system, but more importantly, your metabolic system. So we want to begin to track our heart rate. You can do that very simply with an Apple Watch, a Fitbit, something like that. I got a little ring off of the TikTok shop for like $20, and that really helps me to track my heart rate, not just individually, but also track it over time so that I can put some lifestyle interventions in place. So when you, your heart rate responds when you have a stress trigger. So when stress occurs, that sympathetic activation is going to increase your heart rate and decrease your variability. So as a stress happens, your heart rate is going to increase, but naturally your body's ability to recover is going to decrease. So the more that you've been through these stress triggers, the more that ratio is more defined. And so we want to begin to balance things out, get more averages by looking at our heart rate and then modulating it either up or down. Hey, how are you? Up or down as you need to. If your heart rate is too high for whatever reason, or if you feel like you can't handle your heart rate being higher, like I said, when I would do a lot of HIIT workouts, I just would feel almost like my chest was going to explode. And so as I was tracking my heart rate, I was like, you know what, I need to stay around this 140. And so sometimes, the higher the heart rate variability, it's not necessarily a good thing, especially if your heart rate's used to shooting up because of external stressors. So we really want to keep it more in a balanced state, and that's why that parasympathetic response will help to not only increase but then decreasing as well. So we want to improve our recovery phase where our heart rate can go up and down, and we build that resilience throughout time, and that we are actually controlling it, not necessarily an external situation. So we should be able to, using this tool, we should be able to know our heart rate well enough to begin to modulate our heart rate and get a consistent number. Hey, Christopher, how are you? So when we're dealing with our heart rate and our mental health, again, we look at, let's say, anxiety and depression. We know that people that have anxiety and depression disorders are typically going to have that lower heart rate because they're internalizing that stress consistently. And so the more that their autonomic nervous system is loading the stress and not able to recover from the stress, it's going to maintain at that lower rate. Also, too, if you have a higher heart rate variability, it's going to show that you have greater ability to regulate not only your nervous system, but also in kind your emotional responses. And the idea is to use heart rate as a biofeedback tool to train your body to be more resilient against stress, but also have more emotional control and resilience. We also know, of course, that heart rate is going to affect your sleep, and some will actually track your heart rate, like some watches and things like that will track your heart rate consistently, over your sleeping time, so you're able to see what your recovery looks like. So speaking of sleep, again, those heart rate fluctuations are going to happen during the different stages of sleep, and the highest values are going to be during your deepest level of sleep. And so that nocturnal heart rate variability indicates that parasympathetic activation. It indicates that the body is able to get into rest and digest and able to repair itself on a deep level. But when we have sudden heart rate drops, that can let us know sleep apnea naturally, or stress reactions, or even environmental disturbances. So if we notice spikes, let's say around 3 to 4, we know the liver is affected. Let's say 1 to 2, we know the lungs are affected, etc. So it does give us a little bit more of a window in to what's going on to some of the other internal systems. Not to mention your circadian rhythm and balancing that circadian rhythm, which is just a combination of your nervous system and your hormonal system, and how you have your heart rate patterns over a 24-hour period to really optimize your sleep. You should wake up in the morning super refreshed, go throughout your day kind of a steady decline down of energy, and then kind of towards sleep, really kind of gently going into sleep, sleeping deeply throughout the night, one cycle, no wake-ups, and then waking up refreshed again. So that's definitely what we're shooting for when we're looking at your sleep quality. If it's inhibited in any way, then of course we know that there needs to be work done. And then we know that heart rate is directly tied to the immune system. And so heart rate decreases kind of rapidly in an acute immune response. So once you develop something, let's say cough, cold, flu, etc., it is going to drop drastically. And then that sudden drop actually indicates more inflammatory response within the system, and then persistently low heart rate naturally opens you up to more systemic inflammation because you're not able to get into that recovery. It's showing us that the system, because it's so stressed with mental and emotional, psychosocial, spiritual things, it kind of stays in those low levels, which of course is going to now drive more inflammatory process and more of a compromised immune system. So we want to start to elevate our heart rate slowly over time. So we're going to first look at those averages, get those numbers. Again, it's a wide range of 50 to 100. That sweet spot, though, is your 70. So we want to definitely make sure, that you're not going up and down. Make sure that when you start testing your heart rate that you are well, because naturally if you have a cough, cold, flu, or something like that, your heart rate is going to drop. And then, you're not going to know what to do after that. So make sure that, you maintain your heart rate. Even if it drops, it can come back up, doing things like, breathing exercises, doing, more rajastic breaths like breath of fire, bringing more Kundalini energy to the body is going to allow for that heart rate to come back into alignment and build its resilience. So as your body, your body is oxidizing or you're aging, it is natural that your heart rate variability or your capacity with your heart also declines at about 3 to 5% per decade. And this is going to, as you begin to age, it's going to begin to show us your biological clock versus your chronological clock. Just because you've been on the planet longer doesn't mean that you're less resilient. In fact, if you begin to optimize and train yourself biologically, you can create a lot more superiority that's not there, right? And so maintaining your heart rate does help with that cellular repair and being able to employ your immune system, whenever. So we want to look at regular exercise as well as stress management as tools. And again, if you have a chronic disease such as cardiovascular disease or diabetes, that heart rate is going to be consistently low over time because there's a stress response there. So we do want to improve heart rate trends and validate interventions that we're doing. So if we're working out and we're noticing the increase and or we're meditating, we're noticing the decrease, we just want to keep with that treatment plan and stay consistent with it. Also too, with autoimmune conditions, because they are so complex and so nuanced, we do tend to see fluctuations kind of back and forth and up and down with no real rhyme or reason to them. So you're going to use your heart rate tool to be able to develop an understanding of what your patterns are. You're going to then begin to create conscious communication or conscious awareness around your autonomous nervous system, what it's doing, what it's not doing, and how you can assist it. Because naturally, we want to take ownership, control, and agency and sovereignty over our bodies to begin to learn how to shift from that sympathetic state into that parasympathetic state, building upon our resilience. So biofeedback training really helps to create neuroplasticity within the brain and helps the body to be able to heal. So it's a really good option for those people who maybe necessarily can't afford insurance or some sort of level of care to assist there. And even still, when we do heart rate assessment, we do take a clinical assessment. We provide the objective analysis, which is an opinion, something outside of me, something outside of you. And then the objective analysis here is your heart rate combined with all of the other things that maybe you're telling your provider, like, oh, I had this happen at work, or I had this happen, at home, or, I wasn't able to do this or that sort of thing. So as we're case taking, we're also seeing incidences where the heart rate variability needs to come in just as a consistent tracking tool and or something that helps to regulate the body and helps regulate from stress. We naturally will look at the trends over time. So I tend to look at least a 2-week block of the trends before I make any kind of determination. And naturally, holistic doctors we're the premier preventative doctors. I know, again, people love to hate doctors, but understand conventional doctors and holistic doctors, we're not the same. So they look at the body from this lens of diagnose and manage. We look at the body as an amazing self-healing organism that can and will heal itself if given the right environment. And there's lots of clinical research out there regarding heart rate variability and how it's used in quantifiable data. So we want to detect any early warning signs with our heart rate changes. So any sudden drops, any sudden increases, that's kind of first thing we want to look at. How is that being, is it consistent or is it really kind of aggressive stops? And then we want to modulate our treatment effectiveness to see, so if we are, let's say, trying to elevate our heart rate and we're using meditation, maybe a breath of fire, we want to keep checking our heart rate to be able to see, okay, is this improving? Is the work that we're putting in actually assisting? It does help with energy and recovery time as well. And then naturally, when we have a case that we're co-treating on, meaning I'm treating with, let's say their primary and their endo and whatever specialist they're working with, I tend to bring heart rate variability into the conversation to help to optimize the healing of the body. And again, we want to build these long-term strategies, but first we need to get our basics, our foundation down, like our sleep, our water, our food, etc. And then once those are in place, now we can start kind of refining. I don't like to get into too much stuff all in the beginning because you can get into analysis paralysis, get overwhelmed, shut down, and do nothing. So we really want to do it a little bit at a time. And again, if you have a smartwatch, if you have one of those chest straps, I had one for years from kickboxing and spinning and stuff. So a lot of times you can get them from, your health place. And then there is a couple apps, HRV training and elite heart rate really kind of guide you through what you need to do step by step. And then you want to track it so we can look at hours. I always like to say, if you don't track it, it doesn't exist. And so it just like, we don't guess, we test. So all of those things are important in their determination. So again, healthy by range is 50 to 100. I like it smack down in the middle, 70. I'd say 70 would be the baseline, and then accelerated from there, 80, etc. I really wouldn't go past 90. That's just my personal opinion. Not for a resting heart rate anyway. That's too high, I feel like. Recovery typically starts after heart rate variability after 24 to 72 hours, and we do see up to a 30% improvement potential with the heart rate. So understanding how the mind works, how a person works, really understanding their fundamental experience as a human being is going to help guide you in this process. So, yes, so let's see. So there's a potential increase for 40% when you do this protocol. So meaning after about a month, there's a potential, if you do this, to increase your heart rate by 40%. And what you're going to do is you're going to do a daily 20-minute meditation practice, very, very simple, where you're going to be, sitting, hands interlaced in front of you, eyes closed, and you're going to be bringing air into your nostrils individually. So you can choose which nostril you want to bring it in, left or right. And then what you're going to do is you're going to consistently breathe out of that one nostril, and then you're going to switch it back and forth. And what that does is it really commands that autonomic nervous system to calm down. It tells your sympathetic system to rest and digest. It may be hard at first to get over that resistance hill, but once you've got over it and now you're working through it, you will notice an improvement. And so really, I would say your heart rate, again, it's going to go up, it's going to go down, it's going to fluctuate. However, if you've sustained it and it's consistent, it takes about 72 hours to bring it down. So if you've been working and that kind of thing, those numbers will improve. Okay, so raising and lowering. So raising is you're going to use high intensity interval training for about 20 to 30 minutes. So that's going to be more of your like kickboxing and Pilates and things like that. Kickboxing can also be more in a higher tier of energy just because you're kicking and moving around. Although you can, kind of cheat code it a little bit and make it a little bit easier. But whatever it is, we want to maintain consistency because these things do not shift over time. They really take more time to cultivate and grow and build as you're going on. Remember, this is a lifestyle, not an event. This is why we do these webinars, to really teach you how to incorporate these things. If you're called to heart rate variability, great. If you're not, please don't force yourself to do it. It's not really one of those things. So as you are gathering your life, right, you're going to be triggered, and that's going to trigger that sympathetic nervous system, that vagal nerve, that fight or flight. So cold pack to the chest immediately after an event, right? And this is going to take a little bit. So we're going to, let go of, hold on one second. Bear with me, I apologize. Okay, so as we're doing this, we're going to, kind of let go of any external forces and really focus in on that daily meditation practice. That 10 to 15 minutes really is that sweet spot. I do one in morning flow every morning, and that's going to help us to sustain our heart rate. Whether it's up or down, meditation really helps modulate you wherever you need to go, but it takes a few weeks. So it takes about a month to see this consistent practice to really help shift and be consistent. Remember, we don't want it super high. We don't want it super low. We want it more in the middle. That's why I said that 70 is a sweet spot. 80 is for high achievers. If you are like a marathoner or triathlete, somebody like that, it's going to be more in the 90s. If you work out a lot and like a lot of high intensity, it's probably going to be in the 90s. 80s. I really like it again in that 70s. That 70s is that sweet spot because it's not too high, it's not too low. You're optimizing not only your autonomic nervous system, but also to your maximizing your recovery. The higher the number, the higher the recovery potential. But again, you have to be able to sustain that. And so that's where sometimes you're not able to sustain that. Jumping up all the way isn't necessarily going to help. So we want to really work on building our stress resilience. That's through journaling, that's through working out, that's through meditation, that's through various different components that we are practicing. All right, so that should cover it. Nice, sweet, short training on heart rate. There's really not a lot to it. You're going to grab your Apple Watch, your Fitbit, whatever you have, your Garmin, your Whoop, and start tracking your heart rate. You're going to do that for over 2 weeks. You're going to see what your averages are. Remember, the numbers are between 50 and 100. We want a sweet spot of 70. If it's too high, we want to work on that daily 15-minute meditation practice to bring it down and modulate it. If it's too low, like in the 50s, 60s, we really need to work on doing things to excite it. Meditation is one of those things because it's going to help with that stress resilience, but we're also going to couple that with a little bit more of a moderate intensity exercise just to help bring that heart rate up. I wouldn't go into high intensity if you have some sort of trauma or event like that. I would stick with more moderate if you're just looking to elevate it. So remember, small consistent changes over a short period of time are going to definitely have long-lasting results. And really, it should take about 6 months to get the heart rate completely regulated where you're in charge of the heart rate, not the other way around. So, all right, wonderful. If you guys are in our community, the replay for this video will be in there. It will be under a wellness collective that's going to be showing up in the next couple days or so. It'll be under the Resilient Mindset Wellness Collective. That's where this particular one goes. In our Intro to Holistic Medicine, last week we introduced heart rate as it pertains to stress. This week we're going to talk about heart rate as it pertains to exercise. So our class training tomorrow, which is Wednesday at 7 p.m., we're going to go over a low, moderate, and high intensity exercise and how that impacts your heart rate and what numbers to look for. So definitely take a look at that. And also many of our collectives that are coming in. Perfect. So, all right, we're done with our little Lunch and Learn webinar. Thank you guys so much for attending. I appreciate you all, and I'll edit this video, chop off the first part when we were dealing with TikTok and all the craziness. I'm gonna go on TikTok probably live later today and just do an info session, seeing as how we weren't able to get on